For those patients who are thinking about IVF treatment, how long it takes or what to expect when you do an IVF treatment, I'm going to talk a little bit about IVF, how long the process takes, what goes on when you do an IVF treatment. So simply, we begin with a consultation. So you visit the hospital, preferably with your partner, to have a consultation. You'll see the doctor, in this case, who is going to ask you some questions. And these are just simple questions, basically to know how long you've taken without having children, what treatments potential have you tried before coming to the hospital to try an IVF treatment, if there are any surgeries you potentially done before that may affect the IVF procedure, and many other questions, but these are all simple questions. So through various tests done on the man and on the woman, the doctor will make a diagnosis and say maybe you need IVF treatment. So when that has been reached, you will be given what we call an IVF program. So an IVF program usually takes roughly about 2 months. And this starts from the day when you are registered to say you're going to undergo an IVF treatment. When you're registered for an IVF treatment, you are encouraged to do the first step, which is to check the womb to make sure there's nothing wrong with the uterus that may prevent implantation of the embryo. This is through a simple test we call hysteroscopy, whereby a small camera is introduced inside of the uterus. It's actually painless, it takes only just about 15 minutes. And after this procedure, if the uterus is found to be healthy to have implantation, then you're allowed to proceed to the next step of IVF treatment. This procedure usually takes only 1 day, and you're not under anesthesia. You do it in theater, but you're not under anesthesia, so you can do it in 1 day and still go home and everything is all right. So the next step of IVF treatment will be what we call down regulation. Simply, this means we have to control your body's hormones before you start an IVF treatment. We do this by giving you a small pill which you take on a daily basis for roughly about 21 days. You're going to take this pill from home, just 1 pill every day. There are no common side effects that we're aware of, but if anything unusual, of course, comes up, you're always free to consult the doctor and you'll be given any information that you think is necessary. So once you finish these 21 pills, you're going to have a menstrual period. So that will be after 5 or 7 days after stopping the pill. So when you have a menstrual period, that's when the actual IVF process begins, the actual IVF treatment. And the actual IVF treatment actually takes only 30 days. Prior to that, what you've been doing is what we would call preparation and preparing the body. But when you start an IVF treatment, this only takes only 30 days. And this starts when you start a period. So when you begin a period, you're going to come to the hospital for a few tests, which include an ultrasound scan and a few blood tests, also to know that your hormones are in order. And if all those tests are fine, then you're allowed to start what we call stimulation of the ovaries. Stimulation of the ovaries, this is a process whereby you receive medication to allow the ovaries to produce multiple eggs in one cycle. Naturally, a woman produces usually 1 or 2 eggs at max in a normal cycle, but when you're going to do an IVF treatment, we usually desire this woman to produce more than 1 egg. We shall explain the reasons why we want the woman to produce more than 1 egg as we go along. But when we do the stimulation of ovaries, that's the target, to produce multiple eggs. And the number of eggs a woman will produce will usually depend on a variety of factors, but the biggest factor is usually the age of the woman. Over the 14 days that this woman is receiving medication for stimulation of the ovaries, we shall be doing ultrasound scans to know the response of our ovaries to this medication. So after 14 days, we would expect that the eggs in the ovaries have matured. We can be able to count potentially how many eggs have matured. And then now we prepare this woman for the next step of the treatment in IVF, which is called egg collection. So at the point of egg collection, a woman is taken to theater. In theater, she'll be given a little bit of anesthesia, just what we call sedation. So it's slight anesthesia. It doesn't involve breathing support. The patient is still able to breathe by themselves. They're just slightly sedated, so slightly sleepy. They are given the second type of anesthesia around the pelvic area to reduce any pain that they would incur during the process of egg collection. So the egg collection is done using an ultrasound guide and a needle, which is passed to the ovaries to be able to harvest the eggs that have grown over the past 14 days. Once we have been able to collect these eggs, we now come to the partner, who is the spouse. This is the man now. The man comes in at that point to produce a semen sample. We encourage the man to produce a semen sample using two possible ways. One is masturbation. The other method is what we call coitus interruptus, or withdrawal method. And once the man is able to produce a sperm sample, we take this sample to the laboratory. So the laboratory now has the eggs that have been collected from the woman and the sperm that has been collected from the man. And in the laboratory, a doctor called an embryologist is able to perform what we call IVF. And this is a process where the eggs and the sperms are mixed together. In the lab, there are two types of fertilization that can take place, and usually this is dependent on many factors, but most of the times it's dependent on the quality of the sperm. So if the sperm quality is healthy, we only do what we call conventional IVF, whereby we just mix the eggs and the sperms together. But if the quality of the sperm is insufficient, either it's low sperm count or the sperms are not moving properly, we do another technique in the lab which we call ICSI, or intracytoplasmic sperm injection. This is done about maybe 4 hours to 8 hours after the eggs have been harvested. So the next day, the lab will check to see if the eggs are fertilized, and if that has happened, those eggs will be put in an incubator where they're allowed to grow and progress for a period of 3 to 5 days. In those 3 to 5 days, the eggs are examined and you're given a report on how those eggs are growing. And if they're growing healthily and we think they're eligible for a transfer, then we let you know that now you can come through for an embryo transfer. So from the time you started the IVF treatment on day 2 of the period to the point of embryo transfer, this has been a period of roughly 17 to 19 days. When you come through to the hospital for an embryo transfer, you're first of all prepared by the nursing team. You're given instructions on what to expect before an embryo transfer. And after you receive these instructions, you go to the embryo transfer procedure room, and in the embryo transfer procedure room, an embryo transfer procedure is going to take roughly about 2 to 5 minutes. This is the painless procedure. It's done when you're awake. The embryologist will first come and explain to you the embryology report, which means he will give you an update of how your embryos have performed, the grades of those embryos, and then you can discuss how many embryos you would like to transfer depending on your particular case. So this is an individualized decision, and it's dependent on the quality of the embryos at that point, the age of the patient, and other medical factors surrounding your case in particular. So the number of embryos that will be decided will be a personalized number. The embryo transfer is done using a very small plastic tube. It is passed gently through the cervix and the ultrasound guide, and these embryos are transferred to the endometrium, or the uterine cavity. This takes only just about 2 minutes and it's not painful. Once the embryo transfer has been done, you are allowed to leave the embryo transfer room, and then you go to the ward where you rest for roughly 30 to 45 minutes, and after that you can go home. Once that has been done, at that point the embryos are inside of the uterus. We hope and pray that these embryos are going to go ahead and implant. And when they do implant, then you are pregnant. However, we can only test if you're pregnant after 14 days from the time of the embryo transfer. So we do encourage you to come through 14 days after the embryos were transferred for you to have what we call a pregnancy test. We usually do a blood pregnancy test because it's the most effective and most sensitive to tell us if your IVF treatment has been successful and you're pregnant. Once again, I'm Dr. Gilbert Ayembesibwe, a resident doctor at Lusaka IVF and Fertility Clinic. It's been a pleasure sharing with you about IVF and other treatments that we offer here at the clinic. I hope you've picked a point or two. All these sessions have been quite helpful in informing you about infertility and any choices that you may want to make. I hope this information has been helpful to you. If you have any other questions, any queries, you're free to contact us at the clinic, or you can make a comment in the comment section, and one of the people in the team will be able to get back to you, and we'll be able to respond to your comment.